So it's been a week since the incoming administration has been sworn in, and in that week we have seen an uptick in the number of raids done by the Department of Homeland Security under ICE. And one of the defining features of this administration is that certain so-called sanctuary areas, think places like schools, churches, and hospitals, normally that would be safe from these kinds of raids, are no longer being exempted. And I've seen a lot of creators that are healthcare providers, think doctors and nurses, talk about how the exemption of hospitals from these sanctuary areas will affect the care and the patients that they treat in the hospital. But what I haven't heard talked about a lot, that as a health economist I find particularly interesting, is how healthcare might be more difficult to administer because of the amount of healthcare workers who themselves are undocumented. Now, according to the Center for American Progress, a little under 350,000 workers in healthcare settings are undocumented. And the roles that they serve are pretty instrumental to how the healthcare system runs, from things like housekeeping and cleaners, so the people who keep the hospital clean and sanitary, personal care aides, nursing assistants, and home health aides. And there's so many arguments about how these undocumented immigrants are freeloaders and they're loading on the American system. However, it's important to note that these undocumented workers, specifically in the healthcare system, and I'm not talking about all of the other workers that are there, pay an estimated $5.1 billion in federal tax contributions and $2.6 billion in state and local taxes. Now, they don't get a lot of things out of this because undocumented immigrants are unable to receive Social Security, they're unable to receive Medicare. So they're paying into a tax system that it's very hard for them to directly benefit from because they do not qualify for a lot of the social assistance that these taxes would cover. And they are contributing to a labor force that is treating a population, particularly as the boomer generation ages into retirement and becoming elderly. And these people are getting sicker. Not only do we get a population that is going to require more healthcare as they get older, but we also have generations of nurses and physicians that are boomers that are going to be aging into retirement, which is causing a shortage in healthcare workers. Immigrants are filling those positions, particularly undocumented immigrants, and particularly for those roles I described before. And so if these ICE raids are allowed to occur in hospitals and target not only patients but staff, there is a concern that the shortages created by deporting these people who are working in the hospital would create a potential labor shortage that might affect the healthcare of some folks. And we know from economics in general, this study in particular,